This computer. Okay, good afternoon again, guys. Happy World Fertility Day, and we're back here again. If you are following us today, we are doing live talks on Instagram from 2 o'clock. We've been doing live talks on Instagram as well as Facebook, and it's going to run until 8:30 to this evening. We've got different doctors from all over South Africa, and we also just want to say thank you to these doctors for taking time out to do the talks, but also how important their work is, and how with their help that most of our a lot of women can actually have their family and have their dream family. So today we're talking to Dr. Kobus Coetsee. He's from Vitalab KZN, and we're going to be talking about I had a baby once, can I be infertile now, better known as secondary infertility. So Dr. Coetsee, thank you so much for joining us. It's not the first time we're doing a talk with you, and it's lovely having you as always. So please, if you can just introduce yourself and tell them where you're from and what it is you do.
Thanks so much, Leanne. Thanks for having me on this important day and a very busy day for you, it sounds like.
Yeah.
I think a day like today is very important to share information to patients, and we are very happy here from Vitalab KZN for me to represent our clinic and chat a little bit more about the secondary infertility. So we are from Umhlanga. Our clinic is in Umhlanga, and we are 3 doctors currently working there, Dr. Sky de Jong and Dr. Noloyolo Siku, and as well as myself.
Okay, awesome. So we're going to get straight into it. What is secondary infertility?
Well, that's basically when you've had a baby and now you're trying for another baby and not falling pregnant, or it can also be if you don't carry that baby to term, i.e. having miscarriages.
Okay, and what are the signs of secondary infertility? I don't know if this is phrased correctly, but what are the signs of secondary infertility?
Not 100% sure what the signs are, but obviously the potential causes of secondary infertility is basically the same as that of primary infertility, and we can discuss that a little bit more in length. But the other thing is also, once you've had a baby, patients kind of think, well, I've done it before, I should be able to do it again. And when a patient approaches at the clinic to ask about why can't I fall pregnant with the second baby, it's also important for the doctor to get a complete history of what has happened with the previous pregnancy. Especially like us at Vitalab, we don't deliver the babies, we just help creating them. Yeah. So a full history of the birth of the baby is very important, because it may have been a difficult birth. There may have been excessive blood loss. There may have been bleeding after the delivery of the baby with retained products, where, for example, the doctor had to go back to theater to clean out the uterus. And all of those will be red flags for us as a potential cause why patients can't fall pregnant with the second baby.
Okay, and then I think we've just gone on to what causes secondary infertility, but I think you've actually run through it. But if there's anything else that you want to say about it?
Yeah, I think there are far more causes than what I've mentioned now. So first of all, if we only look at patients that had a baby, that it's also important, how did they fall pregnant the first time around? If they needed some intervention to fall pregnant the first time around, they may need that same intervention, whether that is ovulation induction, that's where we give medication to help the patient to ovulate, etc. And that can also be a problem with the secondary infertility, especially in patients that had the baby and maybe not back to normal weight after having had that baby. That can also interfere with ovulation. The other thing is, how is the patient coping with this newborn baby in the house? Maybe there's a lot of stress, and we know that stress can affect the hormones from the brain affecting the ovaries and can also lead to not ovulating regularly. So the doctor has to look at all of those.
Okay. And then how long should you wait to see a fertility specialist after trying for your second child?
Now, there again, it's very important. How did they fall pregnant previously? If they had to go to the doctor because they were older than 35 years of age, we normally say if you're older than 35, you shouldn't try longer than 6 months on your own. So I think if you fell pregnant the first time around being older than 35, you should visit the fertility specialist sooner than later. If it is that you were younger than 35 and nothing was a problem previously, then yes, after 1 year of trying, you can visit the doctor. But those are all very well saying that. But if you notice that there is specifically something wrong, or you know something that has happened, maybe the husband started going to the gym, maybe using some medication and things like that, those are obvious signs that the patient needs to visit us sooner.
Okay. And then could the male factor also play a role?
I know the male is also a problem. In terms of male infertility, we know that up to 40% of couples, there may be a problem with the male factor. And therefore, one should always assess patients as a couple. So both the husband as well as his wife should come in for the consultation. And one of the first things we'll do is to do a sperm analysis of the husband to assess whether that sperm is good enough to make her pregnant at home or not. And if any treatment options should be offered to the patient to improve the sperm quality.
Okay. Is there any, I don't have that on my question list, but is there anything in particular that you would know, procedure that you would go through when somebody is diagnosed with secondary infertility? What would be your procedure, your plan going forward?
Yeah, I think a full history from the patient is very important, because that's where we normally pick up little clues that will guide us as to what direction to follow. So after the exam, the history, we do a full examination. And remember, all the primary infertility causes can also be present when patients struggle to fall pregnant with their second baby. It also depends on how long, if you only, if you waited 3, 4, 5 years between your first and your second pregnancy, there can be endometriosis, there can be fibroids, there can be tubal disease, there can be a problem with the cervix, maybe a traumatic birth the first time around with a tear of the cervix. All of that can cause problems trying to fall pregnant again.
Okay. And then our last question is, do you have any words of wisdom for women currently trying to conceive, or couples currently trying to conceive?
I think the first thing you don't tell patients trying to have a baby is to relax.
Yeah.
But I think the most important thing is to realize when to come for an assessment.
Yeah.
After the assessment, to get as much information from your doctor as possible. Surgery for secondary infertility is hardly ever necessary unless you've had a procedure done during your pregnancy, as I've mentioned, the DNC for retained products, etc. But to go and do a laparoscopy for a patient with secondary infertility, there are very, very few indications for that. So, try. And if you're not pregnant, if you're younger than 35, definitely after, and patients don't wait for 6 months, they are there sooner. But I think if you're older than 35, then should visit the doctor as soon as possible.
Awesome. Thank you very much, Doctor. That is Dr. Kobus Coetsee from Vitalab in KZN. and we spoke about secondary infertility. Thank you very much, Doctor, for joining us today and taking the time out to speak to us. I will be putting in the comment section doctor's details if you want to contact Vitalab KZN. We will put all the details in the comment section of this. You can also watch the video, or if it's coming now, late, and you have any want to watch the video, you can watch it on YouTube, or it will be posted live to Instagram and Facebook later. Thank you very much, Doctor. Have a great day further.
Thanks, Leanne. Thanks for having me, and enjoy the rest of your day.
Thanks. Bye-bye. Okay, so guys, we have another winner of the juice giveaway, and that's Alzian. I hope I have your name spelled correctly. Alzian, you are the winner of a juice product. The product, I think it's Juice Snack. I'm not 100%. And this is on our, as I said, all these products are available on our fertility product store. Alzian, if you're watching, please contact us. Sorry, you can DM us, or you can just send us an email with your details. Thanks very much, guys, and we'll chat back later over on Instagram. Bye-bye.